Hi students, today we do chapter 4. As promised, I'm doing another video because I have the other ones done from 5 to 11, but I just need to go over my script for 4. We're going to get into scheduling, and for this week we're going to use what's called office hours. Office hours is, well, which side do you think that's on? Is it on the PM side or is it the EHR side? Yep, it's the PM side. Office hours is scheduled on the PM side, but we can share that data within both of them, correct? All right, so here we are, and we're going to schedule patient appointments because we have pre-registered them, and we now have enough information to get those things taken care of. But we actually need to know, is it a new patient or established patient? And in your chapter, they described a new patient as someone who has never been seen, or someone who has not been seen by any one of the providers in the last 3 years. So that could include anyone who is able, who's licensed to see them, such as a nurse practitioner or a physician's assistant. So if they've seen any one of those, or a physician, or any one of the physicians within the group, okay, let's just adjust those, then that's fine. So what information do I need once again in the pre-registration? Just look back and think about, I don't need all their demographics at this point, but I am going to need to know what insurance they have so that we can see them and we can make sure that they're eligible. And you'll also notice in your book, it's going to go over different scheduling methods. Really, we're looking at the stream method here. We like to, for the most part, schedule the patients per physician within a blocked set of time, and most of the time that's 15 minutes. But for a new patient, do you think that we're going to need more time? Absolutely. We're going to need probably 45 minutes all the way up to possibly 2 hours. Well, I guess that means we don't get to see too many new patients in a day. How many do you think you might see? In general, it's anywhere from 2 to 4 new patients in a day, but most likely it's going to be 2 patients. So the rest of the people's schedule will be in regular intervals around that. But I actually am going to make sure then that I have their name and their gender, their date of birth, their phone number, and their email, and what insurance they have. And so once I have that, I can check on the insurance. I can say I can schedule the appointment for them, but that is contingent upon whether their insurance covers the visit with our physicians or our office. So sometimes the patient's going to require a referral or an authorization. We haven't talked much about that, but if they have a health maintenance organization plan, an HMO, they will have to get a referral from their family physician if we are a specialty office, and they will have to be authorized to see the physician for a consult and at least one treatment option. They can always get additional authorizations. We're also going to need to know the reason why they're seen. So based on the reason is a good way for us to determine how much time will be needed. As an example, if someone needs to come in because they have a laceration, it could take longer than usual because the doctor is going to have to determine, can I do this here or do I need to send them over to emergency? And if I do it here, I'm going to have to get the clinical MA to set up the trays for that and the sterile field and so on. So we just have to take a look at how much time might be needed for that. And then the rest of the chapter really is going to go into the different insurance types. Now I know that we're going to cover that in detail next semester, but you do need to take a look at the HMO, the PPO, and the point of service. They are the most popular plans of those available for the general public. Please ask me questions in lab about these. But for the most part, a PPO is the most popular, and they're going to be able to see any physician at any time that is contracted with PPO plans. And they will not need their referral, and they will not need an authorization. If they have the point of service, they generally have that different tiers. So the tier could be something like HMO, PPO, out of network. If that's true that they have those three, they could go virtually anywhere, except the HMO portion has to have the correct medical group. I think I mentioned to you that if we were physician's medical group and our doctor only sees patients that are physicians medical group with that particular HMO, we would have to turn them away if they had a different medical group. We would have to say, you could come to us if you used your PPO option, your tier 2. I'll explain that more in detail. Please do ask me more about that in lab. So that's it for today. Very short and sweet, and I will see you in lab on Wednesday. Hmm. It's not allowing me to save it. That's weird. Hmm. I think something changed on this when I updated this morning. I can't get this to work right. Save as EHR.